letter in the word strong is what? S. Let's check if you guys are with me. So, screenings. So, with my husband, he loves cars. So sometimes he can tell what's wrong with a car just by the sound of the makes and the passing. So I would often tell him he's like a doctor, but for cars, because doctors have to always diagnose and figure out what's going on. And so he takes real good pride in the car, always making sure it's clean, treating it like a baby. I know many of the men in the room are like that, right? So you don't miss a beat with your car, right? You make sure you do all the checks. So that's the same thing you have to do for your body. So you have to treat your body like a car and make sure you don't miss those maintenance appointments. So that's what the screenings are about. So at different age in your life, you're going to be worrying about different things. So I'm looking around the room, I don't see many teenagers, so I'm thinking over 20. So between 20 and I heard we have an 80-year-old. So the first thing when it comes to the screening, I wanted to mention that the first one I wanted to mention was mental health. I could have put heart disease, colon cancer, all of that stuff, but I wanted to make sure the first thing you hear is the mental health. Because if your mind isn't right, then the diabetes is not going to be better, hypertension is not going to be better. So you have to make sure that you're talking about mental health. And for men, talking about mental health does not mean in fact, it's the opposite. So make sure if you're not feeling well, depression, anxiety, PTSD, all of those things, you're able to manage them with the appropriate treatment. I know in the culture to sometimes think God is going to help with everything, but God gave us therapists, and we have to make sure we utilize the therapists so that way they can help us with the mind. Because once you're okay mentally, then you'll be able to follow through with the other medical problems. So the other one I wanted to mention was heart disease. So if you're between 20 and 40, you definitely have to start checking. So I know everyone knows that heart disease is a problem, but I just want to make sure that you're starting to think about it if you're not sure if you have any heart disease. So one of the things you should first do, check your blood pressure. So everybody knows, the numbers to look for, 140, right, over what? 90, but yes, see, somebody knows. So that's high blood pressure. But even before that, if you're checking your pressure and it's in the 130s and it's high 80s, that's a sign that something is not right. So you definitely should start to go and get checked. The number you want is 120 over 80 or anything less than that, But if you're starting to see in the 130s, you try to go and get checked because it's telling you that something isn't right. What else? The lipid levels. You have to know your numbers. So you'll hear these things like HDL cholesterol, whether it's good cholesterol, bad cholesterol, lipids, triglycerides. So once you go to the doctor, they're going to discuss those numbers with you. Between 20 and 40, based on what those numbers look like, they might not suggest for you to be on a statin. You know the statin, right? So the drugs for the atherosclerosis to prevent plaque buildup in the heart. If the doctor suggests it to you, please take it. It's for a reason, right? And it's because they want to prevent you from having blockage in the artery. So that's the job for their statin. So please take it if it's recommended for you. As you age, so if you're in your 60s or your 70s, majority of the time you are going to have atherosclerosis or plaque in the heart. So certain things do come with age. But that's where the maintenance part coming in, and we'll talk a little bit more about the exercise and the diet and so on. Because you can't prevent everything as you age, but everything else that you do impacts that. So if you're between 20 and 40, make sure you know what your LDL and HDL, all those lipid numbers, know what they are. If they're a little high, another thing your doctors can do, and this, please, when you go to your next appointment, you ask them about this, is what's my coronary calcium score? Do you think I need to know about that? And the reason why I'm saying is because sometimes you don't have any problems with your cholesterol. You'll stay normal. The next thing you hear, you had a heart attack. Why? Because nobody bothered to check inside by doing a CAT scan to see. But those risks increase with your family history. So if you know many people in your family had a heart disease or heart attack, talk to the doctor and say, I don't want to have a heart attack at 60 or 70. What do I need to do? What do I need to check? Doc, are you checking everything? Is there anything else? The doctor talked about this thing called calcium score. What's mine? Okay? I'm not actually a pediatrician, so I don't deal with the adults, unfortunately, but I have many family members, and it doesn't matter if you're a pediatrician, they're going to ask you once you're the doctor in the family. So I am constantly making sure I talk to the adults in my family about the correct things for them to talk to the doctors about. Okay? And a quick and easy way, when you go home, you measure your waist. So many people think is, oh, but you're on the scale, and it looks like, okay, you're overweight, I have a problem, but it's more so the circumference of your belly. If it's over 40, that is an increased risk by definition for heart disease. So all I'm trying to say is, if you have a risk, and the majority of us do, you just have to now do the things that help you to prevent getting those heart attacks and so on. Okay? One last thing I wanted to say about the heart disease. You guys, you hear it all the time, the signs and symptoms. Because somebody in your family or your friend is going to have a heart attack and they're going to ignore the signs. One that is not very common, but that can happen, is pain in your jaw. Right? So not every jaw pain is going to be a heart attack. There are many other things. But just don't ignore it if you're feeling this nagging pain. It's because there are nerve endings from the spine and the chest that goes up to the jaw. So that coupled, if you're having the jaw pain, coupled with the pressure in your chest, on your arm, those are signs. This pressure in your chest all the time, coming and going, or this numbness in your arms or neck pain. So those signs, don't ignore them. If you feel like you're having a heart attack, you call 911. If you have aspirin at home, 81 milligrams, you take 2 of those. And it makes a big difference if you can do that while the ambulance comes. Okay? It's better to be safe than sorry. Alright? So if you show up at the hospital and it's not a heart attack, kudos, that's good, We don't want you to stay home and then you're having a heart attack. Right? So next thing is prostate cancer. So guys, with the prostate, because it's so close to the bladder, you'll have a lot of problems with urine. So if you feel like you're having problems with urination, it's painful or it's hesitant, or you're seeing blood in the urine, or you're having problems with erectile dysfunction, please go to the doctor. When it comes to prostate cancer, the recommended age in the US usually is about 40. But just being black alone is a risk. So if you're 40 and you didn't get your PSA checked, go tomorrow, tomorrow, Monday. Go tomorrow and get it checked, right? Don't wait for them to suggest to you. You tell them you were at the guidance function and the doctor say, I'm 40, I'm black, I need my PSA checked. And the reason why is because if you detect that you have a PSA that's high, and high, the number that you're looking for at 40 is anything above 2.5, right? So if they say, oh, your PSA, and PSA is prostate specific antigen, all it means is a protein in the blood that tells you how your prostate function is doing. So if that's high, then their treatment, so you don't have to end up dying from that if it's caught early. So that's the problem, because the men don't like to go to the doctor to get checked, but they make sure their hearts are checked, right? So that's why we have to go, because there are things that they have to prevent those things. If you're older and say you're 60,
It's okay.
and they check your PSA and it's 2.5, well, that they won't worry about, because that number now needs to be good, right? So it all depends on what age you are when you're going to get checked. But what I'm saying to you, if you're 40, you need to get checked. If you have a family history where your brother had prostate cancer, your dad had prostate cancer, go get checked tomorrow. If you have a family history where two, uncles got prostate cancer, please go get checked tomorrow. It's better to be safe than sorry. What do we say in the Caribbean? A stitch in time saves what? Right. to mention, so usually, and this is, one of the few things that isn't worse in blacks is testicular cancer, right? So this disease, this testicular cancer is very common in teenagers, so younger boys. But it happens in older men too. Not so much black, but it can happen, so it's easy for you to check. So basically you're checking your testicles to make sure you don't feel a hard mass. Or you might see that it's swollen suddenly, or it becomes very heavy, or you're having a lot of pain in your lower abdomen, or it shrinks. Anything that looks different and why that you can help pay attention to that too. And let the men know you need to go get checked. And I wanted to mention that because those are easy signs that you can look for, but you wouldn't know if nobody is telling you, like me, right? So make sure you do that. Colon cancer. I didn't want to put this in here because you all should know a lot about this already, right? So again, if you're 40, men, most times the doctors will wait till you're 45. Don't wait till you're 45. Just tell them, Dr. Wilshire say I'm 40, I want to check now. Okay? Because again, it's not just the age, but family history has a lot to do with colon cancer. And also, they have different procedures you can do. The colonoscopy is just 15 to 20 minutes. It's really simple, but for some reason, some men don't like to do it. If you do it and it's normal, then it's every 10 years. But there are other tests, one that they can mail to your house that you can do. The only thing is when you get the colonoscopy done, if they see something abnormal, they can take care of it right away. Right? So you want the gold standard, right? Diana, we known for gold. So anytime they say this is the gold standard, then yep, I want the gold. So do the colonoscopy, and then you don't have to worry about that. So two other things I wanted to mention: skin cancer. So most women know we go out in the sun and we wear the sunscreen, but a lot of men don't really put on sunscreen. So sometimes the skin cancer can creep up on you, but if you have a particular mole on your body and you notice that it's changing in how it looks, like the size, it looks bigger, it looks darker in color, the borders look a little different, then you go and get it checked. There's no harm in getting checked, right? But if you let it fester, then you can end up with skin cancer, and we don't want that. So colon cancer is actually the second leading cause of death of cancer in the U.S. for both men and women. Do you know what the first leading cause of death with cancer? Anybody? So it's lung cancer. Lung cancer, and I'm talking about this because if you're a smoker and you're between 50 and 80, tomorrow please go get checked. Tomorrow, some of the problems, you don't have to be a smoker to have lung cancer, but that's the most common way that they're going to screen you. The other way, they're not going to ask you, because you're not in the doctor when they ask you, do you smoke? Most likely you're going to say no, right? Also, if you're not between 50 and 80, then they're not going to know if you have a problem in your chest. So what are you going to look for? You're going to look for if you have a cough that's been going on for more than a month, right? Or if your chest is hurting when you're coughing, or you're persistently tired, persistent breathlessness, you don't have energy. A lot of this sounds like it can be a lot of things, but it's best for you to go and say, I don't feel well, something is not right. Dr. Wilshire said that could be my lungs. Can you please check, right? So that's the thing, because people are ending up with cancers and they don't know how they got it, but they're ignoring little signs because they didn't speak up, okay? So just try to ask about those things. Sometimes in our community, disparities is a big problem. Patients are ignored, the doctor is not listening to you very well, but advocate for yourselves. Go with your questions that you want answered. Ask about your family history as well. So when you go, you can say, well, my aunt had this, my great-grandfather had this, so they kind of now see that this is a trend. And seek second opinion. If I, as a pediatrician, and somebody wants to go for a second opinion, I am not going to be mad, because as a physician, you don't always know everything, okay? And make use of the virtual care. So telemedicine now is everywhere, so you have no excuse to miss your appointment. Just ask them, I really can't make it there. Is there a way that we can do a telemedicine call? Okay, so you try to use that. So those are really all the screenings that are, to me, if you make sure you have those down pat and you look for those symptoms, you're going to be fine. Again, right now, you probably might have heart disease, you probably have diabetes, you probably have hypertension. Those things can be controlled. Once they're controlled, your life will still be good. So that's where the other part of the strong comes in, the T, the R, the O, and the N, and the G. That's how you help to control it. So what's the T? Time management. Guys, I know someone was saying that there was no TV, but there's TV now, so there's a lot of TV watching. If you're like the man in my house, you like to watch a lot of basketball, and it can be hours and you're watching basketball or cricket, right? But manage your time. How are you managing your time? You can always control what you do in the day, especially when it comes to finding that 30 minutes, that's the magic number, 30 minutes a day to exercise, to get the heart pumping. If you try to do that, it really does make a difference. I know, trust me, I try to eat healthy. It is so hard because you gotta spend some time in the kitchen to prepare the things, right? It's easier to go through the fast food line, but you've gotta manage the time. So remember the T in strong, time. And sleep. Remember, what is the saying, Diana? Early to bed, early to rise.
Makes a man healthy and wise.
Healthy and wise. It's true. You gotta sleep, right? So if you're not sleeping, and what's the magic number of sleep you should get?
8 hours.
I heard 8, but 7 is the magic number. But some people might think 10 or 11. That's too much. If you're sleeping that much, go to the doctor tomorrow. There might be some kind of depression or sleep apnea, something, right? So the magic number is 7 to 8 hours. So try to get the sleep. Because when you do these kinds of things all the time, that if you're not sleeping well, then it affects your stress level. And when you're stressed, then the blood pressure goes up, the diabetes is not controlled. So all those things. So if you're not sleeping, let them check. Sometimes sleep apnea. Actually, in blacks, sleep apnea is one of the #1 reasons why we're not getting enough sleep. So make sure you're doing that. Okay, so guys, turn the TV off, Make sure you're exercising. So the R in strong, resetting your mind, right? And the point about resetting your mind is pretty much just think positive. All of us go through hard times sometimes, and as men, you have a lot of pride, you might fail at something, or you might lose your job, and it stresses you out. But know that, you're strong, so you can think how you think. Take a different perspective. Just look at the positive side of whatever you're going through. Ask for help and see how you can change your thinking, because just that alone will help you to make the right decisions and move forward, right? We all fail at something. Trust me, on my journey to medicine and becoming a doctor, I failed multiple times, but I never gave up. I always had a good outlook, And with God, He always has a better plan for you. When you think this is the road you need to go down, and when they run into a roadblock, it's because He wanted you to go somewhere else, and where He has for you is always better. It's not a question of if it's better. It's always better, right? So you reset your mind. And the O in strong is optimizing your opportunities. So meaning, you might say, I don't know how to exercise, or I don't know how to eat healthy. These are things that you can find support. So optimize what's in your community. What is your church offering that you can learn from? You hear a guide today and you're getting this message. So you try to go and be involved in things. Online, there's so many opportunities. Instead of scrolling down Facebook for the wrong things, you join the groups where you can learn, right, about some medical tips. So those are the opportunities that you optimize. I do that. I follow people who influence me in a positive way. you know. So if you know you have prostate cancer, you can go on Facebook and look for a group with prostate cancers and see what you can learn from people there. So that's what optimizing opportunities are. And then the end, this one I had to search a little bit. What can I talk to you about the end? But then I remembered it's Sunday, and you guys are missing church. So I said I have to put in a Bible verse in there. So what Ephesians 6:4 tells us, it says, "Fathers, provoke not your children into wrath, but bring them up in the nurture and admonition of the Lord." So the end is just nurture. As fathers, you know, if you think of making sure you have a nurturing environment for your family, it also helps you. Because if you have a nurturing environment for your family, it's going to reduce your stress level because you have good communication, you have good relationship. It helps your physical health because you guys are doing things together. One of the things I said, you know, my husband wanted to start working out more. I said we can all go walking together. As we're walking together, then we can talk about certain things. So creating a nurturing environment is important. And lastly, the G is gratitude. We have to always have an attitude of gratitude. No matter what you're going through, sometimes the days seem very chaotic, but just stop and thank God or be thankful for the little things that you have. You know, so thankful for your family. Even though you might have a medical condition now, thank you that you still have life. But then you gotta do the other things for the strong man stuff. Like, you know, are you doing the time management, doing your exercise and stuff? You can't just be grateful and not do anything about it. So you be grateful, but you still continue to do the other things that you know is gonna be helpful. So gentlemen, take a moment these days to count your blessings and be thankful. And so just to wrap up, just to go over what I said as we leave today. So remember, and this is doctor's orders, this is your prescription. The men today, women too, but I'm talking to men, it's Father's Day. Prioritize your what? Your S, what's the S? Your screening, right? And the T, manage your time. Right? What else? The R, we got to do reset your mind, make sure you're thinking positive. The O, optimize the opportunities that's around you. And the N, nurture, make sure you're being nice to your family, and that's going to also have a positive impact on your life. And G, gratitude. Right? So here's to you guys, strong fathers, strong sons, strong brothers. May God continue to bless you, and thank you very much.